Relationships between patients, providers, and intermediaries form a core of the healthcare system. But there are other players and other interactions that are also important. We should take note of a couple others in particular. First, the role of governments. We've already noted that governments can be involved in setting up and operating intermediaries, but governments can play other roles as well. In some countries, governments are directly involved in providing care. They may directly hire physicians, or they may set up and operate hospitals, for example. Even when governments are not directly involved in the operation of intermediaries or in the provision of care, they are very often part of the story in that they regulate aspects of the healthcare system. For example, it's very hard in most countries that have private intermediaries to set up and run one without some government oversight. It's also generally very difficult, maybe impossible, to set yourself up as a healthcare provider, be a doctor, run a hospital, for example, without some licensing or oversight from the government. So frequently, governments are involved in managing, overseeing, regulating many aspects of the healthcare system. They need to be part of our picture too. Second, we should take note of the many other companies that provide goods and services used by providers and patients. There are companies that are developing drugs or devices, manufacturing them and selling them for use in the healthcare system. There are lots of other companies operating in and around the healthcare system also, providing services to healthcare providers, sometimes services to patients. For example, creating data systems and computer systems that can manage patient health records. Sometimes we call these electronic health records or electronic medical records. As another example, there may be companies looking to create applications for patients that they can use to manage their health. Now, beyond these two groups, there can also be others, depending on the system. There are professional societies and related organizations that work with providers, like medical associations that work with physicians. There are groups and professionals working on public health. There can be philanthropies that provide or finance care for people that might face challenges getting care. The list could go on. Overall, it's important to remember that healthcare systems have a variety of components. We'll try to draw out the most important ones. We'll have a focus on intermediaries and providers in particular, but we never want to leave entirely off all these other entities as well.